Hello, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today, we are interviewing Maribeth Crupi from Boston.
Yes.
Welcome.
Thank you. Hello.
Hello.
I will pronounce my R's, I promise.
Yes. We actually encourage the accent.
Yes, okay. Absolutely. Yeah. Love it. Love it.
So Maribeth Crupi is a physical therapist in Boston area who established a private practice in 2007 with a specialty focus on care of dancers of all levels. Maribeth is a contributing author to the recently published Prevention of Injuries in the Young Dancers, editors Ruth and John Solomon and Dr. Lyle Micheli. She has lectured extensively to both dance programs and her peers in an effort to promote best care and training strategies for dancers. Her practice also offers backstage services to professional companies performing in the Boston area, including work with Boston Ballet. Maribeth emphasizes working with the healthy limits of the dancer's body to avoid injury without sacrificing artistry. She is particularly passionate about promoting health and wellness in the adolescent dancer.
Maribeth is here today to discuss pre-pointe screening and pointe shoe readiness. Let's dive right in. So our first question, why is it important to assess for pointe readiness?
Well, first and foremost, as a physical therapist, it provides an opportunity to possibly prevent injury. It allows me to determine if the any areas that could exist of muscle weakness, muscle or joint tightness, or excessive ligamentous flexibility. And when we speak of ligaments, I'm talking about the structures that attach bone to bone. And we want to know what shape all of those structures are in. I want to look for any potential postural deviations, both static and when a dancer is moving through transitions of their different gestures, as all of this will give me an opportunity to offer advice and exercises to correct any problems I find. It provides an opportunity to educate the dancer, parent, and teacher. So it really goes beyond just determining do they or don't they rise on point. It really allows them to understand their dancer's body. It allows an objective means for the dancer to understand why they are or may not be ready to progress to this discipline. I'm able to educate a dancer in my screening process in a manner where they can see how they may be struggling to meet a necessary movement, balance, or strength milestone. I explain that I am first and foremost committed to keeping them healthy, and it is a win-win situation, as the vast majority of advice I'm going to offer will also allow them to improve their dance technique. It's so much easier for a dancer to understand why more time is needed before they progress to pointe work when they can see or feel what it is that they need to improve upon. And at the same time, I'm able to give them a means to work on their areas of need. They most often are not disappointed with the weight if they really understand it. And finally, it really helps, and especially in a suburban, dance studio, the concern is always of mother and dancer. Why is it that all my peers are going up on pointe and I'm not? Mm-hmm. And I can help explain that it's not about years of training, but it's about your individual needs. And in some instances, it might mean that I have to give the advice that pointe work may not be the discipline that they should pursue. While I don't enjoy it, I'm comfortable with being the one to share that message, and thankfully it's not frequent, as I am referencing it around my concern for their health, and that's usually much better received than potentially being told by their dance teacher that they're not ready or able, which to the dancer often gets translated to, I'm just not good enough.
Yeah. That's a really hard conversation to have.
That is a very hard. I couldn't imagine being a dancer and being told that. But I like how you are very confident. You have the experience to help a dancer realize maybe what path of dance might be better for their body.
Right.
Yeah.
And if they understand it's truly coming from caring about them as a person, they receive it in such a different way.
Yeah, absolutely. So let's talk a little bit about what elements do you include in a pointe readiness screen?
Okay. So obviously I could take a whole podcast to answer this question.
Naturally, yeah.
So I'll try to be as succinct as I can. But first of all, I always want a general health history. Mm-hmm. And in particular with our female dancers, we have to get some sense of what their menstrual history is, what their nutritional habits are. And also I'm always concerned, especially in the Northeast, about their vitamin D levels, mm-hmm. because all of these things can create a potential snapshot into their bone health. And, for those that are listening who aren't healthcare providers, it's important to understand that even if you have a calcium-rich diet, if you don't have enough vitamin D in your system, you're not able to utilize the calcium you take in. Given the demands and forces being placed, particularly on the lower limbs, I'm sure, that I want to be sure that I won't be setting a dancer up for potential bony stress injuries. Mm-hmm. I want to know what their aspirations are for dance. Why point work? If they're not interested in pursuing point work as a long-term goal, I remind them that they may be placing a lot of demands on their body, and they should be sure they want to take on this rigorous discipline with that in mind. I want to know about their ballet training history. They really should have had at least 3 to 4 years of training and at least 3 ballet classes per week. And then moving on to the more physical milestones I'm looking for. First and foremost, we're looking at posture. What is the position of their pelvis, their feet, how are they carrying their upper carriage, their ribs, their shoulders, what kind of position are they holding? And when I'm looking at that, I'm also looking how they hold their posture through different movements. Just looking at how a dancer can move from double limb stance to a single limb balance can be very revealing about different areas of weakness in their body. For example, if they're clenching the floor with their toes, if their ankles are wobbling, or their pelvis is not staying level, right away that starts to give me some indicators where they might have some weaknesses before I even have to do any testing of that nature. I have to get a sense of what their hip external rotation range of motion is. So, in the ballet world, they talk of it as turnout, and most of it should be coming from the hip, especially in a young dancer. And what I'd like to do is assess, the difference between actively how much they can rotate out that hip and passively, because lots of times it's not that they don't have good turnout, it's just that they're weak, they're not able to access it, and that's where I can come in as the physical therapist and really teach them specific exercises to expound on that. Certainly, I want to make sure that they have adequate ankle point range of motion and plie depth, because your plie depth is how you're absorbing shock when you're landing your leaps. And then certainly, if you don't have enough ability to point that ankle and foot, you won't be able to get up fully on the toe box. A great test is just the simple, what they call the pencil test, and you literally just lay a pencil on the top of the ankle, and if it lies flat, that's generally a good indicator that they have adequate point range. I go on to certainly assess their strength, and in particular their lower abdominal muscle strength, because we want that core to be well developed. And then there's certain, basic milestones about how many elevates they can perform in a single leg, 20 to 25 if they're going to do point work for sure. I want to make sure they can do single leg sautés, at least 8 with nice form. They're not lurching forward. They're not straining their neck. They're not tilting their pelvis forward. And just something as simple as being able to perform a clean single pirouette from fourth position with optimal form and a clean finish. Now, there's other tests, and what I want to do is offer to everyone in the 2010 Journal of Dance Medicine in Volume 3, Megan Richardson, Mary Jane Liederbach, and Emily Sandow wrote a great article that offers a lot of these milestones. So if you're looking for these specifics in greater detail, I'd offer that you go to that article.
That's great. I love how you go into great detail for people listening in on all the things that go into being ready for point. It's not just one thing on a checklist.
It isn't.
Right. I actually want to go back. You made a statement, and I just want to clarify. I think
Sure.
part of it is a little bit selfish, but maybe there's someone else in my shoes who had a similar past. I started training in ballet before going into physical therapy. I was a dancer like Marissa. I started training in dance around the age of 4. And we didn't go on to point, I believe it was 11 or 12. So you said only 3 to 4 years of training.
No, I want at least 3 to 4 years of training behind them. Yes.
At least. Well, I'm just thinking the comparative.
Because just to be able to first of all, just to be technically proficient, you have to have that much training to develop the strength from a dance perspective to be able to hold your postures and gestures. If you don't have that much training and you're working in a flat shoe, imagine now how when you're bringing yourself up onto a toe box, what the demands are on your body. So you have to have a good sense of how to move your body in space, how to go through the different technical demands of dance in a flat shoe before you could ask yourself to do that on point.
You explain the importance of the technique from those 3 to 4 years, the minimum of training, very well. It's more the idea that I trained since I was 4 all the way to 12. So you're saying somebody who started at 8 who had less years of training. I didn't know that few years of training could make it possible.
And I guess when I'm talking about ballet training, I think we're really looking at when you approach the bar, because that's when your true discipline ballet training begins, when you're placing yourself at the bar and you're going through your rigorous ballet training in terms of plie, tendu, dégagé, all of that in a manner where you're also being asked to rely on holding optimal posture, etc. In those early years, dance is supposed to be fun, and also body types are different when you're younger. I mean, the things that we look at in a dancer that's at 9, 10, or 11 are different for a dancer that's 7, 8, or 9. In fact, some of the things you'll see in that younger dancer are normal for them. A pelvis that's tipped forward, knees that look like a little knock-kneed or valgus, that we expect in that population. So that's why we wouldn't be screening them so young.
Yeah, thank you for clarifying. What are some common weaknesses that you see in young dancers that inhibit them from going up on point?
Certainly pelvic placement is a huge one, and that usually stems from weakness about the hip girdle. Most commonly, the outer hip girdle, there's one muscle in particular that tends to be very weak in a lot of our younger dancers, is the gluteus medius muscle, and that's the muscle that's responsible. Most people think of it as the muscle that lifts your leg out to the side. But when you're standing on one leg, that same muscle is what's helping keep the pelvis level. So in younger dancers, when that muscle isn't activating appropriately or is strong enough, they'll tend to go to the opposite side of the trunk and overactivate one of the side trunk muscles called the quadratus lumborum, QL, not important to memorize a name, and that will hike the opposite hip up to make them appear level. So you want to look for those subtleties in how they might be making up for weaknesses and how they could be compensating. Again, lower abdominal weaknesses are core, and I'm talking deep lower tummy muscles, deep muscles in the back. Those are the muscles that, in developing dancers usually need a lot of work. We see a lot of weakness in the large buttocks muscle, the gluteus maximus muscle. A lot of dancers tend to be really dominant in their hamstrings and the muscles in the back of the thigh that bend the knee, but also do have some hip extension or arabesque movement involved. But I'd rather that they be using their larger buttocks muscle to bring that leg up behind them for their arabesque. And also, conversely, if they improve the strength of that muscle, they tend to help decrease tension and tightness in the hip flexors, which in this population tends to be a concern as well. Certainly, ankle weakness is something that we see quite a bit in these dancers. It tends to also go with foot type. Sometimes a dancer that has a foot where the toes are sharply tapered to the side, they might struggle a little bit more with keeping that midline ankle position when they're up on their demi-point, and then that would be a greater concern when they were up on their box. And then, as I started with, improper balance and weight shift. It's really important for them to understand about how their body should be aligned when they're moving. Because if they trick us, if they trick a dance teacher by looking like they're level, but they're actually holding tension in other muscles that aren't best served for that movement, that's when they start setting off the chain of events in which they could create a painful condition.
Nice, that was a good explanation.
Yeah, that's great.
Do you have any suggestions then of how to make a dancer physically and technically stronger so that they're ready for point work?
Yeah, the first thing we have to do as healthcare providers, and you're doing a great job right now, is to share our knowledge and open up as many opportunities to educate dance teachers on how to best prepare these developing bodies for dance. That's first and foremost. Then moving from that, intrinsic footwork. I'm still surprised, so let me talk about intrinsic footwork, meaning there are muscles that just start and end in the feet. And just briefly, the quickest way to know that a dancer might be using those inner foot muscles versus muscles from the calf that work the feet is what's going on with their toes. If I can get a dancer to lift the arch of their foot and maintain the length in their toes, I know they're truly using just the muscles in the foot. When I see a dancer point their foot and I see a lot of heavy toe curling, that speaks to me about a lot of use of muscles from the calf working the foot. And I really want a balance of both. So a lot of training around foot and learning how to strengthen those 4 layers of muscles in the feet. I also, want to keep in mind that most dancers are rising on point during adolescence, and they really need to work on balance and weight shift at this time because with their rapid growth, their center of balance is moving away from the floor. So they can easily get frustrated because they're, suddenly having to work more on their balance, and yet at the same time, we're putting them up on a point shoe, which is bringing them further from the floor. So this is really a perfect time when muscles are tight, when it's more risky to do lots of flexibility and stretching work, to actually focus on what will help them both with their body and the discipline, and that's, balancing and weight shift type exercises. I personally can't imagine, not only for my dancers, but anybody in my practice, doing any kind of strength work with them or training with them without establishing some sense of a true core, the deeper muscles that create that true dancer center. So they need to have some type of core stability work. And I'll say we work through, it's called Australian Physiotherapy Pilates Institute approach at my practice. What I like about this particular approach is that it's taken traditional Pilates exercises and broken it down into many levels. So I don't have to worry about the age of my dancer and an exercise being too strenuous for them. I can actually work at very low levels and really teach them how to get that true local core stability. Certainly they need to do dedicated ankle strengthening, whether it be with Arab bands, whether it be against gravity, doing heel raises and weight shifts. And also real important with this, though, so many dancers do their ankle strengthening just with their knees straight. Remember, they need to do work with that knee flexed or bent so that they can get those deeper muscles strong as well.
Absolutely.
Yeah, and the one thing that I want to make sure that they also have is they need cardio. They need to have a good aerobic base. And remember, any of us in this area of specialty know that fatigue is a precursor to injury. If we know that dance isn't necessarily aerobic, but we do know that research supports if you have a good aerobic base, you're less likely to get fatigued and less likely to get injured. And then finally, the last 2 points, good nutrition and hydration, and certainly proper warm-up and cool-down, and those are topics for themselves.
Yes.
Yeah. What are some of the consequences of putting a dancer up on point too early?
Well, they can certainly develop overuse injuries. If they're trying to over-strategize at their ankle and foot, they might develop tendinitis at some of the muscles around the ankle. The flexor hallucis longus is a common. It's like the dancer's muscle that tends to get, most aggravated. And most people out of the dance arena probably never see this as a problem in their practice. Certainly Achilles tendinitis. Overworking a weak foot can certainly result in some bony stress injuries. And then certainly so many dancers that tend to be extra flexible or hypermobile gravitate toward dance. We need to make sure that they do truly have that extra strength and stability. That population needs to be extra strong so that they don't develop injuries. And then certainly one of the most important is psychologically, it's really damaging if they are struggling to get up on point and we put them up too soon. It can be really self-defeating because they won't be able to go anywhere with it.
Absolutely.
Yep.
I hear you talking, and I appreciate this a lot. I hear you talking about all different facets of health, not just the strength and conditioning part, but the mental and nutrition aspect. It's so important.
Thank you.
Yeah. So really, thank you. My next question is: at what age or level do you start screening dancers for point readiness?
Well, it does vary. So I have like a conservatory program very close to my practice, and frankly, their dancers are extremely well prepared and strong, and they're usually coming in between 11 and 12 years of age. And I know that there's been some, quest at trying to determine when are bones, fully fused in the foot and grow, and there's not a lot of research to support a set age and saying, yes or no, if the bones are not completely fused, you should or shouldn't go up on point. For me, it's about those true objective milestones. My recreational dancers will tend to come into me usually closer to 12 to 14 years of age because they might not have been training in ballet as intensely over those, prior years. So it really is dependent on the amount of ballet training, what age I'm seeing them. One thing to keep in mind, though, too, just those of you that are embarking on this, is that chronological age, like the person's actual age, might be different from their physiological age. In other words, someone may be 12, but they could have a body that's more like a 10-year-old, etc. So you want to keep that in mind, and usually menstruation can be a good indicator, although many times in dancers that's delayed because of the rigors of their training.
Are physical therapists the only people who can screen a young dancer for point shoe readiness, or can a dance teacher perform this assessment as well?
I feel it can be, it should be a collaborative approach. If you think about it, dance teachers have been placing dancers on point a whole lot longer than PTs. But certainly now, with the benefit of organizations such as the International Association for Dance Medicine and Science and the growing body of research in dance medicine, there's a greater base of knowledge to allow for the safest progression to point work. While a dance teacher can certainly be trained to make observations and learn how to spot red flags with regard to suboptimal movement or posture, They likely do not have the knowledge of anatomy and kinesiology, which is the study of human movement, to allow them to make the best recommendations for correcting technique faults that are rooted in musculoskeletal weakness or unique anatomical features of a particular dancer. And I'll give you an example. Sometimes, I'll have a dancer come to me and it will look like one of their feet is actually turned out, but when I look at their posture, their hips and their knees are facing forward. So that foot being turned out on that limb is actually the result of a twisting, or what we call a torsion in the lower leg bone, the tibia. So if a dance teacher instructs that particular patient that they should be in parallel based on their foot position, they'll actually be asking them to turn their hip and their knee in. So, it's important that we, make sure that we're getting this type of information out to the dance teachers. At the same time, the components of artistry, for best execution of point work are often best taught by the dance teacher, certainly, who has a wonderful vocabulary necessary to create the beautiful movements that we see in the classroom on the stage. I'm fortunate that I have a number of dance teachers who, as they're preparing their students for point work, will refer them to me for further screening if they have any concerns. This allows me to determine more specifically where the difficulty may lie and create an exercise program or recommendation to the teacher that will allow the milestone to be met. I truly have only found dance teachers to be hugely receptive and appreciative of the knowledge I can offer, and I appreciate learning from them as well. I feel it's a missed opportunity to expand the knowledge of best dance practice if we don't try to do this in a collaborative manner.
Yeah, I agree 100%.
Yeah.
Teamwork. So, okay, if there was one thing that you could tell a young dancer about going up on point, what would that be?
It's an individual process, and to transition to this discipline with the greatest joy and ease, they need to meet the proper milestones for this discipline. Don't be discouraged if one of your peers rises on point before you. For both best health and best dance practice, you should progress to this discipline based on your individual strengths and objective measures. And to quote George Balanchine, there is no reason to get a young dancer on full point if she cannot do anything when she gets there.
Thank
Yes,
you, Balanchine.
Maribeth, you have done such a great job at speaking about things in such simple terms that everyone can understand.
Yeah.
PT goals.
Thank
Yeah.
We're now on to my favorite question of the podcast. So please tell us your favorite story of treating a dancer.
Sure. So as a prelude, I'll offer that I frequently say to my patients that my goal is to put myself out of business. In other words, I want the dancers to become so knowledgeable about how to care for themselves that they do not feel that they need to rely on me to stay well. I get the best satisfaction from stories dancers share of how they use the knowledge that I offered them to overcome a problem or painful condition, and I'll share two quick examples. I treated a pre-professional ballet dancer who was extremely hypermobile, and we had worked through a number of injuries over a 2-year period of time. She was finally pain-free, strong, and attending a summer program at Central Pennsylvania Youth Ballet. She emailed me twice during her intensive, once to share how frequently she was complimented on how strong she was. And the second time, she emailed me to let me know that she was singled out in class as the dancer who best kept herself out of knee hyperextension.
Congratulations.
That was so gratifying, not just for me, but truthfully, what was more important to me, that I was so excited that she was getting that message from the artistic end. Mm-hmm. That means that we're making inroads. Yeah. And then the second situation was one of my patients who was a multidisciplinary dancer, and she was at a dance competition. She was having some stiffness in her ankle and didn't have her TheraBand with her to do her self-mobilization that I had taught her. So she improvised with a pair of tights. I thought that was really inventive, yeah. And now she shares that, and I share that advice with other patients. But even better, that same day, she was watching another dancer getting ready to perform, and that dancer was struggling with the taping that she was doing to her ankle. The first dancer knew the technique as I had taught it to her, so she went over to help that dancer apply the tape, and they soon came to discover that they were both my patients. So it was really gratifying to see the trickle down of one of my patients teaching the other something to help them.
Oh, that's so great.
And it's also further proof that you followed HIPAA.
Yeah.
Which is great, because they didn't know about each other.
Yeah, exactly.
Exactly. Yeah.
Wow, thank you so much for all of your incredible knowledge. I really appreciate it.
Yeah.
Thank you for this opportunity, and you're doing an amazing job. I can't thank you enough. This is just what the dance world needs.
Oh, thank
of course,
you. Yeah.
Of course.
Happy to contribute.
We hope all of our listeners benefit. Actually, we know they should.
Yes.
And speaking of which, thank you to all of our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you. Bye.
Thanks. Bye.